I'm here with somebody whom I would like to introduce you. This is Sanjiv Manek, the chairman of the AuroMira Centre in London. His father was a great devotee. He used to keep coming to Puducherry. Then he started a place of his own meaning another centre, to which he gifted his property and it became a trust. He is the head of the trust and a few members who run the place. I must tell you about this particular centre. It runs with a lot of precision. The sincerity with which people work there. Somebody looking after the flowers, somebody looking after the relics, somebody looking after the messages are sent out every day to all the members. And I also receive it every day. It's a very nice feeling to get something beautiful from Mother Sri Aurobindo directly on your pad or on your phone. So, and then every Saturday they have talks, or they're readings basically of Sri Aurobindo Mother's writings for 1 hour. Various on Savitri, on education, etc. It's a very interesting session, and when I'm not, of course I'm not in England, whenever I'm here, I try and see that I attend. Fortunately, they always hold a meeting when I'm about to doze, here in the afternoon at 2 o'clock. But I keep myself awake, because I want to listen, because it speaks with so much sincerity, enthusiasm, that it's a pleasure really. You feel one with them. So, since he happens to be here, he is on a holiday, and holiday well taken, because he's been traveling, he's had some tragedy in his family, then his daughter got married, which was a very big thing. So, with all that, he happens to be here. So I thought, if he speaks to you, and he heads the pathology department of the Oxford University. So, subject chosen is pathology and integral yoga, which sounded very interesting. So, I'll ask Sanjiv to take over and go ahead.
Thank you very much, Pradeep Bhai. I find myself in a very strange situation here. And I got a WhatsApp message last Tuesday to say, I'm really excited that you're coming, and what will be the subject of your talk? And we had never actually discussed that I was going to give a talk here. And it took me by real surprise that I was going to be given a chance to talk. And to talk to people here who are, very advanced sadhaks who are in this practice all the time, I could not really think about what to, bring to you. And then I thought, my profession, pathology, is somewhere where I admire the divine on a daily basis. And why should I not share that with you? And that is why I thought I'll bring to you what pathology is. You may have some conceptions about it. You may have heard little bits and pieces of what a pathologist does. And share with you my perspective of, how integral the divine is in the body, through its physiology and through pathology as well. So, to me, I was guided into doing pathology after I became a medical doctor. In the very early stages, there was absolutely no question that, this is what I wanted to do. And if you to ask somebody what is pathology, it basically is the science of the body, science of diseases, but I also regard it as the yoga of diseases and the yoga of science in it, because it looks at what causes diseases and helps other medical professionals like physicians and surgeons who rely on pathologists to cure the diseases at its root level, not just curing symptoms, because symptom curing is much more easy. But if we are able to guide other physicians and surgeons as to what's caused the problem, then that's where the pathologist comes in. And in a way, it's a study of matter in the form of the body, and very much like study of matter in other fields, like studying elements or studying elements, bits in physics, how certain metals work or how electricity works and all that. This pathology is a study of the body as well. And the beauty of it is that we have to know what normal is. If you know what normal is, then you know what abnormal is. And when you look at what normal is, you just cannot but admire what the divine is in that. So what I thought I'd do is break up pathology into its components and what it is. So a lot of people might have this idea that pathology is about morbid anatomy, which a lot of it is. And so a big part of the work is to look at the body at the time of death. Okay, so literally opening up the body and looking at the organs and to find out what is the cause of death. And many people often, raise their shoulders or question me and say, what's the point of finding out the cause of death? So there are two main reasons. One is, for many people, it gives a closure. If a family member dies, if you are able to tell them exactly what it is. We are all going to die, but there has to be a cause that leads you to that death, a physical cause. And if you're able to say, so-and-so died because of such and such a condition, I think it gives a lot of closure. But also understanding the body as to what caused that condition that led to death also allows us to understand those conditions such that we might find cures for those conditions or find ways to avoid those sort of situations. So we actually are studying diseases and conditions even at the time of death as well. And I remember a very long time ago when I first started training in pathology, and I started looking at bodies and I started doing autopsies and postmortems. And that is a big part of the job. And you look at the organs and you think, who did this? The way the organs are structured, it's very neat. They're always in the same place, and you can see the interconnections. And I find that it's a miracle. It's how, the way I see it is how the mother has structured everything in its right place. And sometimes the divine has a laugh. Sometimes what's supposed to be on the right side of the body turns out to be on the left side. But it doesn't matter. The function is still the same, But we find the anomaly a mystery, but also a divine joke at the same time as well. And it gives us something to think about. What's also beautiful, I find, is that the organs have their own function. So each organ is made up of tissues, which are very specialized. These tissues are made up of cells, which are very specialized. So a liver cell functions in such a way that a kidney cell cannot function. And yet, the function of the cell in the liver is very important for the function of the cell in the kidney, because the kidney is involved in certain functions like detoxifying elements so that it keeps the blood purified, so that it helps the kidney to work that much better. So when I'm looking at the body, I can see, they're placed in such a way, they're connected in such a way. It's all worked out. There's a big architect up there who has it. But it's not just looking at the organs where I can see the connections, but even within the organs, because I have, as a pathologist, almost 80 to 90% of my work is actually microscopy. I look at tissues under the microscope. So I look at the tissues and I'm thinking, even there's amazing design. Okay. So a tissue, if I'm looking at a bit of tissue from the liver under the microscope, is very different from, say, a spleen or part of the bowel or let's say the heart. They're all different cell types, each with its own function. And again, I'm thinking, only the divine could have created this. Everything is worked out. So that's at the tissue level when I'm seeing all this. And at the tissue level, we confirm what the condition is. So I can look at the organs and say something has gone wrong here. Then I can take a little bit of tissue from that to look at under the microscope, and I can identify the condition that's gone wrong. So when I see that, it's very easy to then pick out what can be done to prevent something like that in the future. And that's why the advances in medicine are related to pathologists telling the other people in medicine, what goes wrong in an organ and how we can prevent it. What's happening more recently is that we've gone down to the level of the cell. So again, a lot of microscopy that I do, I study single cells at a time, and it's just beautiful. Okay, so when the mother talks about become vast like the ocean, become vast like the universe, I would also say become vast like the cell. The cell is got a milieu of itself. It's got its own medium, its own liquid, and within that there are multiple little elements. So you might have heard names like nucleus, nucleolus, mitochondria, ribosomes, genes. Everything is in there. And when you imagine that you are a little gene, you are in a universe. You are as vast because there's outside of you is just that cell, the cell border. And that again is marvelous. And then each little element that's in the cell has its own function. Okay, so we've heard about genes, for instance, but what makes those genes drive? They create proteins, but what makes those proteins come about? So you have other little things like mitochondria, you have ribosomes, and all these little names that I can talk about. But every single bit of that goes on. It needs things like chemicals like calcium and sodium and potassium and all that kind of thing. So God has given the recipe. Every ingredient has been thrown in there. So when we are conscious of our nutrition, we are conscious that we have to put all those elements in us so that all these cells can function properly as well. Okay, so that's the science behind living in a sort of high consciousness way, where we are tending to our body. So there, for me, is a big miracle as well. How each cell works, and when I look at cells against each other, so if I'm looking at, say, a piece of skin, right, the cells are harmonized with each other. Okay, they're in such harmony so that one cell doesn't crush the other one, right? And you would never have thought of that, but I'm telling you, they live with each other in harmony, and it's almost like they're supporting each other. And so at the cell level, you have that harmony. At the tissue level, you have that harmony. And at the organ level, you have that harmony. And one of the things that I find that some of the powers of the mother, represented in her petals, apply to the body as well. So there is generosity there. The function of one organ helps another organ. It's generous. Here I'm giving you purified blood. The other organ shows tremendous receptivity there as well, because it's getting that purified blood elements from it. So the receptivity and and the generosity is not just us as mental beings, it's there at the physical level as well. And gratitude, whenever I see all these organs in function, in harmony, you have to be grateful to the divine. I would say that all of you at some point, or every human at some point, should be shown the organs in a body. I know we study, those who study biology, we might have looked at organs one at a time, sort of thing, but it's actually amazing how you can, we can't see what the mind is, we can't see what the vital is, but we can definitely see what the body is, and I think everybody should have that opportunity to see, what a marvel that is. The other thing is, look at an organ like a heart, right? In most situations, it will beat persistently for 70, 80, 90 years, right? That's mother's perseverance, isn't it? That's one of her powers as well. The heart perseveres. And when you look at what makes up a heart, and, the heart itself needs to be nourished. It has its own blood supply. And there are 3 major arteries that supply the heart, and then little blood vessels coming out of those. And you look at that and you think, well, it's absolutely wonderful, that entire organ that supports a human for 80, 90 years. Okay, it fails sometimes, but the majority, will live with it, with their own heart. And there it is. It does it on 3 little blood vessels that the divine has provided, So we have to take care of those blood vessels, and this is what all of cardiology is about, that you have to make sure that you don't disease your blood vessels. Okay, so that's where I'm going to bring in a bit of integral yoga as well. And then the function of each organ is, again, bringing in another power of the mother, and that's goodness. Right? Its entire function is to make sure that the whole body remains purified, disease-free, and able to support the mind or the vital, or whatever you want to call it, for further progress. And if it wasn't for the organs, we would not be here listening to each other and even thinking about reflecting on this. So I find that even just studying the organs at the organ level, or the tissue level, or the cell level, mother's powers come into it as well. I mean, they have to, right? Because she created them. So, there's a miracle about it. And one of the other things that has struck me recently is that, a lot of the mothers and Sri Aurobindo's writings are about the outer being and the inner being, right? And I don't think we are thinking about the actual physical part of it. We are probably talking more about the psychic, the vital, and the mental aspect of it. But there is an inner self of us, and the inside of us, that we should be aware of and marvel at as well. And that inner being is very crucial. And I think if you are aware of it, then we would probably become a bit more conscious of when things go wrong in it. Okay. And there is a process with all these organs. There is a way the function works. And I think the mother calls it the inner law. I think there's one quote that I have seen in the past, which I think I've written here. So mother says that illnesses are the result of a disharmony, of a lack of equilibrium, of a disobedience to the inner law, right? And that inner law is what the organs, and I don't think most of us think about that at all. We eat our food. We might pray that, the food nourishes us enough for our progress. But who has thought about what's happening to that food, right? Has anyone ever visualized what happens? There is an absolute inner mechanism and inner law that goes on in there. And this is what I'm going to, when I finish, going to leave you with this thought about, take it a step further and see, visualize, what actually happens, to the food. Talking about the divine's grace or the miracle on the body, I just wanted to mention a couple of things. So there is a condition or a normal process, it's a normal process called programmed cell death. Okay, and pathologists, we study that a lot. All right. Now, we are all programmed to die as humans. Okay, so it shouldn't come as a surprise that at the cellular level there has to be cell death as well. Okay, and we know that in some of the organs the cells are regularly dying anyway, and this is where mothers' teachings come into it, where they say you have to die for new growth to come in. All right. So there are many organs in the body where there is programmed cell death. Old cells go, new ones come in, especially in environments where defense is very important. Okay. An attack against hostile forces. So I'm talking about things like microbial agents, viruses, bacteria, or even trauma, cut in the skin. So we have to have defense in that. So the cells have the capacity to regenerate and repair. Okay, so the divine has placed this program called programmed cell death, so that new cells can grow, perhaps stronger, perhaps more enlightened, perhaps with more consciousness in it as well. And that is a very important function of the body. And the reason I'm dwelling on that is because when I talk about disharmony and disequilibrium, one of the things that can go wrong is the programmed cell death as well. So if I take that a bit further, one of the things that we study in pathology is what has caused the disease. Okay, and as pathologists we learn that it could be genetic, so you're born with it because it runs in the family. Okay, so in that respect, you have to just surrender and accept that the divine has given you that condition. Okay, so you're born with that pathology. The other is trauma. So you hurt yourself or you get hurt. And again, there's something that you can do about it, So in a day-to-day practice, I'm sure the mother has said that if you are more conscious, you will get less hurt as well. And so you prevent trauma. Other is attack by infectious agents. Okay, so bacteria, virus, parasites, all sorts of things. And we've all lived now through COVID, and we've seen how dangerous that has been. Okay, so we study how infections can cause illnesses in the whole body or in specific organs. And then the other condition that we often come across is metabolic as well. So things like diabetes come into it as well, and how it affects organs, how it damages organs as well. But what can we do about diabetes? So the study of metabolic conditions is also part of pathology. And the biggest one is cancer. Okay, so study of cancer is a very, very big part of pathology. So whilst we're studying all of this, the divine has taken us even deeper into this science. Because we've gone to the cell level or even the subcellular level, we are now able to look at some of these conditions at the molecular level as well. Okay, so we've gone into the cell, not just by electron microscopy, but by even going and picking out genes and seeing where the gene has gone wrong. Okay, so we know a cancer is developed, but when we study the cancer cell, we can see, oh, this is the gene that mutated, it's transformed, it's gone wrong, and that's why the cancer has developed. Okay, and when that happens, we find ways to reverse that mutation. Okay, so the knowledge and the intelligence, the vital energy has gone to such an extent that pathologists are able to look at that molecular level and find root causes to say, okay, we can prevent this cancer. But even if you can't prevent that cancer in the future, let's say, if you know what the genetic mutation has been, then you can target treatment specific for that patient, okay, which was not available even 10 years ago. The advances are such that, all these things are rapidly evolving. And when we find, in terms of cancer, here are a couple of quotes by Sri Aurobindo, which I found very intriguing at a time when, cancer was not that very well known or encountered. And somebody has asked Sri Aurobindo, and he has said cancer can be cured by yoga, but on condition of faith or openness or both. And then in one of the letters on yoga, I think it's in volume 4, in the section on cancer, he says it's not inevitable, and there's no such thing as incurable illness in reality. Okay? The only reason we call it incurable is because we haven't found the remedy. Right? But now, through the divine intervention, through people like pathologists, we are finding the root causes, and we're finding remedies. Now, in my 30 years as a pathologist, I've seen lots and lots of cancers, but I'm still surprised and sometimes baffled when I come across a new cancer. And I'm in a very niche section. I'm a gynecological pathologist, so I deal with gynecological cancers. And even in that, and I thought after 30 years, I will have seen every cancer that there can be. And it wouldn't surprise me when I go back to work next Monday, there will be a new format of cancer that will appear, right? And there's magic in there as well. When you look at the cancer cells under the microscope, you think, I've never seen this before. So the divine has revealed himself yet in another format. There's a magic, there's color, there's design, there is mischief as well in the way the cells present themselves in cancer. And you think only the creator can have done this. And then what's left for us to do is to say, all right, now the divine has presented another form of cancer. Now we have to go and study that as well, right? But in doing so, what you find is you come across other genetic mutations, other problems, and then you think, yeah, okay, there was a reason behind that, because now you are able to deal with other new cancers that come up on the scene. Okay, so there, Sri Aurobindo has said it. There's no incurable disease, because it's curable because you find the remedy. But we are gradually, constantly, progressively finding these conditions, and we progressively finding the remedies as well, because we now understand some of the diseases in a much more intricate way, say, than even 5 years ago or 10 years ago. Okay, so even my day-to-day work has changed quite a lot. If I now say to a surgeon, oh, you've just removed a cancer, they'll say, yeah, but that's fine, I knew that, but I want you to tell me, what's happening at the molecular level, all right, so that I can treat my patient, that much better as well. And as pathologists, especially somebody like myself, who has been very fortunate to have followed this philosophy from birth, to say, yeah, I've been open to new dimensions, new horizons here, and it's my time to progress and to learn something new, and help further, humanity as well. So these are the sort of main causes of illnesses, and cancer being the main one. And going back to how it's related to programmed cell death. So what happens is that a cell that is supposed to die, if it doesn't die, is going to, because it has mutated, something has mutated at the gene level that's stopped that programmed cell death from happening. And so what happens is the cell starts to multiply because it hasn't died. it needs to propagate. And when it starts propagating, it multiplies. And the line that the mother uses is this: the cells of the body get the habit of increasing without pause. This is cancer. If you change the consciousness in the cells and get rid of the habit, cancer can be cured. Okay? So the habit has been lost because that programmed cell death has been lost. The ability to kill off yourself has been lost. So so you have to change that habit. So what we do is we find what that gene mutation has been that has prevented that programmed cell death, and we reintroduce that gene. And we've got to that stage now that we can reintroduce that good gene. The good cell starts to grow and outgrows the cancer cell as well. But despite all that, what we don't realize, and I'm telling you as a pathologist, is that these things are going wrong all the time. There's disequilibrium all the time. All right? On a day-to-day basis, something is going wrong in your body, but the divine has provided us with amazing defense mechanisms. Okay? So call it a policeman. There's a policeman in us that deals with all these little errors that are going on every day. Okay? We might deal with errors outside of our body, on ourselves, as we see them, but internally there's a law, there's a proper law, and there are policemen there that actually deal with the problems on a day-to-day basis. And it's only when the disequilibrium is very vast, it's overwhelming, that's when our natural defense mechanisms may not work. And that's when, we fall ill or we develop cancer, and that's when we will need help, from physicians and surgeons and other medical people. And when they come into action, I always see that is the mother working through them as well. The medicines that they provide. Why do we have medicines? Because we have been given that knowledge, that science, to create very specific medicines, to try and not damage normal cells as well. Who's provided that? The divine has provided that with increasing knowledge as well. So what I would say is, that's pathology in a nutshell, how it relates to the marvel and the miracle of divinity. But on an everyday practice, this is what I would say: visualize all these things. Visualize your nutrition. Right? So when you're eating, you've prayed. Mother has told us to pray that it serves its function to support the body. But if you imagine that, first of all, you've chewed your food, chew it well. Okay, take your time, chew it well. In fact, I've learned from some of the older sadhaks here. It was Maheshwari ji who showed me how to eat a mango. And I was just baffled with the way he used to chew the mango right to its last pulp, So you're helping the food to flow into your food pipe, then it gets into the stomach. Just imagine like a washing machine there. There's acid and other nutrients and all that coming in, and it's churning the food and picking out all the elements, breaking it all up. And then some of it gets taken up into the body at that point, what it needs immediately. Other bits then go into your gut, right? And there are two parts of the gut. Why are there two parts of the gut? Has anyone ever thought of that? You've heard of small gut and the large gut. The small gut is where there are very specialized cells that will pick out some of the most important nutrients. Okay? And the cells that pick them out will tire out. They do get tired. So they'll die, but new ones will come in. Okay? So then the nutrition goes in, and so whatever is needed will be taken up, and then there will be residue. And then in the large bowel, there is a lot of absorption of water, for instance, as well. And then whatever is not needed by the body is what we excrete. Okay? So if you can visualize your nutrition that way, and you say, I'm eating this, even if you focus on one thing, I'm drinking milk. I'm going to get protein and calcium from this. You can imagine it flowing through your body. When you do pranayama, you're following your breathing, aren't you? And that's a proper exercise. You are inhaling. You can visualize it going into your lungs, deep down into your lungs. But that's all you see. But have you ever thought of what then happens to the oxygen? It actually has to cross little membranes, little veils, right? But there are mechanisms that the divine has provided. It links onto another molecule, then it crosses the membrane, and then it enters the bloodstream. Okay? So you can visualize the oxygen going all the way into your bloodstream that way. And that oxygen is then carried on your red blood cell, and it goes into the organ and says to the specific cell in that organ, here, I brought you some oxygen. There's another cell that says, I brought you some calcium. Another one will say, I brought you this. Now do your function. So, it's that generosity, the receptivity is constantly happening at that point. So visualize that. Visualize your breathing when you're breathing to see exactly what's happening, and visualize your excretion. When you go and pass water, or when you excrete, that is a normal bodily function, right? And you have to have some gratitude for that as well, because that is showing that your body is working properly. Okay, and sometimes doctors first ask that, don't they? When you go to and see a doctor, are these functions okay? That's the reason why they ask, because they are if something is wrong with that, then often that is a symptom or is a sign that something is not right in the body, right? Just like pain is a symptom and a sign that something is not right in the body. Also, I would say, visualize the death of some of the cells in your body and say, yeah, that's normal process, because I know some cells have to die because new ones have to grow. So you're happy, Did you know that you're shedding millions of cells every day from your skin because new ones are growing behind it? So, when you're having a bath, you're removing the old cells so that the new ones can take their position. Let's have some gratitude for that as well. That some cells have had to die because new ones have had to grow as well. And you understand and appreciate death much more in that respect. So you visualize new growth as well. The other thing that I would encourage in form of visualization is, obviously it brings in a bit of mental and vital energy in here as well, is I'm sure most of you, when you've had, say, cough and a cold or a sore throat, there's a one point when you suddenly feel something's not right here, right? Or in the nose or somewhere like that. So what I practice, and I find this extremely helpful, and it's all about appreciating what the divine has given us, is you visualize an increase in blood flow to your organs. Okay, so you say, I'm visualizing that there's a sharp increase in the blood flow to where it's hurting. All right. And you can imagine that there's a bacterium or a virus sat there wanting to attack. Okay. And you want to prevent that attack. So the divine has provided you with a lot of fighter cells. I won't go into the names of this, but there are at least 10 or 12 different types of cells that actually fight infections. Okay. But you just imagine one cell that it's coming there and it's actually grabbing the virus. And that's exactly what happens. It actually grabs the virus and it says, that's it. No more of your nonsense here. And that virus, the cell has got the defense mechanisms to break up that virus, and then it takes it to other parts of the body, like the spleen or lymph nodes, where it completely shatters it. Now, in doing that, the cell that has grabbed that virus also has to die. Okay? So you have to be grateful for that. But if you visualize that you've been given lots of these cells, grabbed the infective agent and it's destroyed it, that infection will go. And that's what I feel that Mother often means, that, you have a veil or a shield around you, whether it's the mother's protection, you prevent the disease before it comes in. But let's say you feel the first inkling of it, visualizing what the divine has given you, your own mechanism, your own defense, it's magical. And I think a lot has been talked about pain as well. Pain is a symptom, right, of something that's gone wrong, whether it's a joint pain or a muscle pain or abdominal pain, something is wrong. Now, most of us will not know, what has caused that. Let's say you have pain in the abdomen. There could be many, many reasons for it. One disadvantage of being a pathologist is that you start thinking of all sorts of things, that this has gone wrong, that has gone wrong. But the important thing here is that if you visualize and ask the mother to normalize all the organ function, smooth it out, bring back the harmony, then it does that. And that's where integral yoga comes into it, isn't it? Because you are using your mind to bring that equilibrium back. You might be taking in some energy, maybe taking in more oxygen, breathing a bit in a different way. So your vital forces are also coming in to bring your harmony back in there, and that's what you do. And quite often the pain goes away. And if it doesn't, then obviously you seek help. But there's a lot that we can do ourselves, if we're taking care of that. And the reasons why the program cell death goes wrong and disease happens is many times it's our own doing. So for instance, if the mother's word, disobedience to the inner law. So where are we disobeying? Okay, we don't rest enough, we don't sleep enough, we don't eat the right things, or we take the wrong things, smoking or alcohol or anything like that. We should keep things simple. If you eat simple food, then the body is less burdened. The body is able to utilize that food much more easily. And then obviously the other things as part of the integral yoga, meditation, pranayama, concentration, exercise, all of those things. If all of those things are applied in a day-to-day practice, in addition to your visualization, then you're giving your body that specific chance to take its function properly. It gives all the organs their chance to function properly, help each other, collaborate. There's a lot of collaboration that goes on in the body as well. And what needs to die will die, what needs to regrow will regrow as well. So as much as there is reality out there, and we are dealing with that, there's reality in the body as well, right? And as a pathologist, I'm very happy to share with you that this is what we are made of, and we need to take care of ourselves, through all these good practices, and understand, why we need to do that, because we need, whenever there is a chance that something is going to become disharmonious, we need to bring back that harmony, right? And when you look at a lot of Sri Aurobindo's writings and the mother's writings, they all say illness is disharmony or disequilibrium, don't they? And that's what it is. And I think it's in our hands to be able to bring that harmony back as well. And just to end with, I felt that I need to give a lot of respect to the cell, right? I've talked a lot about the cell itself, right? And I've said that as much as there is vastness in an ocean or a universe, there's vastness in the cell as well, okay? And some of the lines in Savitri are just mind-blowing, I don't know if I should actually use that word, but it's just amazing what Sri Aurobindo has already told us, the potential of the cell. Okay, so if you don't mind, I'll just share the odd lines here from Savitri. So, as early as Book 1, Canto 3, our body's cells must hold the immortal's flame. Okay, so basically it does have the divine spark in it. And it can become perfect. Okay, it can become immortal. And if it becomes immortal or it becomes perfect, then the tissue that it belongs to becomes perfect. If the tissue becomes perfect, the organ becomes perfect. If the organ becomes perfect, the body becomes perfect. Okay, and then we may come to a time when we won't need these organs, we won't need the body as it is, because we've transformed. We've become perfect that way. Another line in Book 2, Canto 5, on matters acts, she imposed a patterned law. So hopefully I've talked to you about patterns and the law, the inner law that there is in the body. And I find that there is a lot of patterns in our body. She made a thinking body from chemic cells, so he's referred to chemicals in the cells here, and molded a being out of a driven force. Then another line, in our body cells there sits a hidden power. Okay, so it is our duty to honor that hidden power and think, we've been given this life, so, and we know that there's a power in each cell in our body, so we have to not only find it, but also look after it as well. Almighty powers are shut in nature's cells. So that's another line, and that's in Book 3, Canto 4. Then Book 2, Canto 11, for he who is grows manifest in the years, and the slow Godhead shut within the cell climbs from the plasm to immortality. It's beautiful. And then in Book 7, Canto 4, this is, I feel this is where the mother has told us, telling us that I made all this. In the embryo, tracked the history of forms, and the genealogy framed of all that lives, I have detected plasm and cell and gene.
Oh, wow.
Sri Aurobindo has referred to the gene through the mother, and plasm is mentioned there, the cell is mentioned there, the gene is mentioned there. That's why he's created pathologists, to explain all of these things at that level. And then another one, a divine force shall flow through tissue and cell. And I think that's what we are working towards in integral yoga. So there are a few lines that I felt I needed to say. And also I've already described to you what Sri Aurobindo has said about cancer, what the mother has said about cancer as well. And the only other thing I would sort of refer to is one quote from the mother in Questions and Answers. This is related to the inner law. So illnesses are the result of a disharmony, of a lack of equilibrium, of a disobedience to the inner law. There must be a perfect understanding among all the parts of the being and a perfect accord among them. Okay? So we, as part of our sadhana, should also understand that physical part of our being, the little bits that we are made up of as well, and respect that as well. And not just focus only on the mind or the vital. Obviously, they're very important. Something goes wrong in the mind also will lead to something going wrong in the body. But there's plenty to concentrate on in the body itself as well. And if you get a chance, open up a biology book, look at the organs, look at the photos of that, even if you don't get a chance to, or I'm sure there are lots of videos that you can now see autopsies, and you can see how the body functions are as well. So hopefully I have opened up some insights into what you are made of. Thank you.
The mother talks of awakening the cells of the body, and the physical education that she has given so much importance to. 50% of our education is physical. The physical is the Aadhaar, which Sri Aurobindo calls it the Aadhaar. And if the Aadhaar is weak, the rest of it automatically begins to dwindle. And so she talks of awakening the cells. Now, for instance, you're doing pranayama. When you're doing pranayama, you're deep breathing, there's a rhythm, there's a ratio, and you follow that. And sometimes you forget that the ratio, don't think about the ratio, and think only about the mother. With each breath, you're breathing her, and you're breathing out some defects which are there in your cells, and you feel that she has said that this cells can be awakened. And if you dedicate your pranayama and your asanas and everything, there is an attempt at awakening the cells. Because you might say more oxygen is going in.
And in awakening the cells, you hopefully with this little chit chat, you would now understand what a cell is, right? If you want to awaken the cell, you need to know what the cell is, and then the idea of seeing this oxygen molecule going into the cell, that awakens it, and your nutrition that goes into it, that awakens it as well. And obviously, the mental process as well is important, so you putting in mindful energies into it, and mental thoughts as well, so even a smile, I'm sure, acts on a cell in the right way.
She had written that the rigidity of the being, when you're born, certain amount of rigidity is given to the being to be able to survive.
That's correct.
And that rigidity, of course, slows down the evolution of consciousness, etc., etc. And the gap, sort of equilibrium goes away.
Yeah.
etc. So, what the mother has said, that if you are doing what I tell you in physical education, you will find that this rigidity will become lesser and lesser. And the gap that comes between the evolution of the being, the three parts of our being, and your soul evolution gets smaller and smaller. So you find that your health improves, your longevity improves, and everything begins to improve. And through, as she says, through certain physical education, like tennis, she says. I was just reading the other day, and she said that with each stroke, when I hit a ball at my opponent, I'm giving all my goodwill to those people to transform. So, really lucky if you're playing tennis with her, against her especially. With each ball comes sizzling with all kinds of beauty and energy that really generates in you. It's absolutely fantastic. She said, I don't play tennis. You think I play tennis? I do yoga. I call the divine to my each stroke when I serve or when I hit a forehand. That's what I'm doing, So it's now when you hear all this, 50% of the education is really for the body.
Yeah.
The importance that she gave to the body, and after what you said as to what happens, and all those many words you use, with all those things which are there, it's quite amazing. When you're eating, I think we're all going to eat a bit differently from this evening, right?
Yeah.
Also, what I liked most was the tip that you gave is that when there is a pain, first thing to do is to become conscious and aware of that pain. That point where it's going to really spread very hard. So what you said is that there are these fighters in our body, these fighter cells. And it's like we are the commandos, so we become the commandos only on becoming aware. So we are the commandos, but we've forgotten it.
Correct.
And the moment we give a kind of a visualized message to those fighter commandos, they kind of come and help, and they are actually like the ones who are so sacrificing, and so there's so much of gratitude because they kind of kill the thing, and they also have to die. So that's
and they are there in the body. They are like soldiers waiting to be used. And all it requires is us to be able to encourage them to say, all right, go and do your job now, kind of thing. And that's what happens. And we have to obviously show gratitude for what they are actually doing.
I think that showing gratitude, one is becoming aware, being receptive to their working on you, and at the same time, having gratitude kind of closes the thing gives it a nice closure.
Yeah. I'll just, if you don't mind, I'll elaborate slightly on this in the sense that I didn't go into the details of this, but this is absolutely miraculous and beautiful. So let's say you're fighting a disease, and even if you haven't visualized anything, it naturally starts to happen. What happens is that the cell that is nearest to the attack gets there first, right? Then it says, oh, this is an agent that I'm not used to dealing with. This is a too great an enemy. So what it does, it holds it. So that agent doesn't move. It waits for another cell to arrive that can handle it. And then they talk to each other. It's through chemicals they talk to each other, and it literally passes the agent to the other cell. And that says, okay, now this is your job that you can do it. So even a little cell has its own proper function. It knows what it has to attack, but if it can't, it can have a holding in a function as well. Then there is interaction between, I don't know if people have heard things like B cells and T cells, they're in your bloodstream. So, T cells bring these agents to the B cells. The B cells take them to another group of cells and say, okay, I brought them to you. Now do your job. Kill them. Kill the agent. All that's going on as well. But I think even just to visualize the first responders, like an ambulance comes first, then decides, what happens next kind of thing. So the first responders get there quickly. So you visualize whatever cell is present there, just go there, disarm the agent, the infectious agent, and let the other cells come. And how do you bring them there? You visualize an increase in blood flow. And you know why you feel a sore throat? The sore throat is actually more blood in that area. Nothing else. It's just that it becomes swollen inside. There are more blood vessels there. So you visualize that and say, okay, the blood is coming there. I want more cells to come, and kill off the attack straight away, like that.
And also the fact that you mentioned that the cells have this innate intelligence of even knowing that who is. So it's so beautiful that that intelligence has penetrated so deeply into matter, and it's there.
It is there.
It's just that we have to become aware of it.
So we do talk about the mind of the cells, don't we?
Yes.
And that's the intelligence of the cell.
Well, one question I want to ask. Sorry, okay, you carry on.
Sir, are we individuals? I mean, a human being is a human being a universe given to oneself, considering the cells? I really want to know. Second question is, suppose our blood is concentrated and there is one cell in my intestine. So it might be helping in the digestion.
Mm-hmm.
Suppose I am an athlete or I am performing some dance or some activity. So I am doing some movement. So, okay, in simple way, does a cell perform on multi-level? Can you please guide us?
If the cell is supposed to perform on multiple levels, then it will do that. It will never do anything beyond its capacity, as it were. So I'm not sure how you're relating an activity with a cell for the digestive system. How are you trying to relate that?
It's digesting already.
Yeah.
Digesting
Yeah.
something.
Yeah.
And at the same time, some outer activity is going on.
Yeah.
Performing something. So, does the cell has consciousness on variety levels?
So that cell, the digestive cell, is doing its own little job. It's digesting. So you might have eaten a bit and you've gone for a walk. So the digestive cell is happy doing its own thing. The cell in the muscle is helping you to walk. Different jobs, right? But I don't know if you know that technically you should not be walking straight after eating. Why? Because you should be allowing a lot of your blood to be focused around the digestive system. So give yourself a bit of rest. Let all the nutrition, and digestion take place. And then, it come into the bloodstream, and then, whereas if you started to walk straight after, a little bit of walking is fine, but 3 or 4 mile walk is generally a bad idea until after half an hour. I think after half an hour is fine, because then if you walked immediately, then your blood flow will be more towards your muscles and not so much in there. You've got a limited amount of blood, so it has to get everywhere. So if you're going to force it to be focused on your legs, then it's going to compromise on the gut system, right? Yes, and I always believe the universe is in us as well. The entire universe is embedded in us, but obviously in a different format. The reality is in the form of cells and tissues and organs and all that thing.
When you have a digestive pill, what are you giving a soldier from outside? Or?
You're giving them a bit of relief. You're giving them a bit of time to gather their thoughts, gather their action. Or sometimes, when you have acidity, for instance, what's really happening with acidity is that you get little breaks in the stomach lining, right? So what you are doing with an antacid is to take away that attack from the acid, and then it gives a chance for the lining to regenerate. Okay.
It's more of a comment first and a question. First of all, I think you said you're a gynecological pathologist, but I think you're a poet pathologist. The picture that you painted of the, our organs and the tissue and everything, I mean, it was sheer poetry listening to you. Just, how you were describing, and the beauty of each cell, the vastness that you described. So my question is that when you see that there is a beautiful pattern inside, right? Normal, you said we need to know what normal is.
Yes.
So when there is an abnormality, do you see the disharmony in the design also?
Yes.
And how is that also equally, as a poet pathologist, do you find that also equally?
So absolutely, you say, oh, this has happened, but I've not seen this particular pattern of disequilibrium. It's amazing. You always feel that, how we say that some infections are a step ahead of us, or some cancers are a step ahead of us. It's not that. It's just that we haven't, that particular pattern hasn't manifested to us before, but we're now able to recognize that new pattern. And the beauty of it is that you say, oh, wow, I'm glad I've seen this pattern now and I'll remember it. But then the amazing thing is that the next time it will be a completely different pattern as well. So you can see it, and there is divinity in there. And I think this is what I mean by the cell mischief. The cell has the capacity to show us its different forms as well. And I haven't gone into this very much, but even within normality, there's a variation as well. So you have to appreciate a vast range of normality. If you regard all of us as normal people, there's a variation. So even in cells which are normal, there's a bit of variation as well. But you have to, once you appreciate that, then the abnormality, the disease becomes much more evident as well. And looking down the microscope at these cells that have gone wrong, it's just remarkable that even in disease, the divine has taken the trouble to create patterns. Right? And you know why he's done that? He's done that because we are too limited in our knowledge. So if he creates a pattern, then it might trigger off another pattern in our mind and say, okay, I've seen something vaguely like this before. Maybe this is what it is. It opens up a door for you like that.
So a related question is, you are also a professor, right? You work with future pathologists.
Yeah.
Is this kind of a way to understand pathology? Are you communicating this? Because this idea of, we talk of science and spirituality, medicine and spirituality, but this is really the way to talk about it. Is this pretty standard now?
So the curriculum will not allow that, right? But wherever I can bring it in, I do. In my lectures to the students and to my junior doctors, I always do. And I find that those who are open will understand a bit more. But one thing I always will say, if I'm teaching them on a microscope and we're looking at a few cells, I will tell them, respect this cell. Why? Because it's got 10 different forms, which is normal, right? So understand that. If you recognize the 10 different normal forms, you're giving it respect, right? Then you'll be able to find out what the abnormal is looking like. So I'm saying this, they might not take it as yoga or as integral yoga, but they're taking it as some kind of connection,
I have one question. Some person who was very sick here, he had cancer, and it had 3-4 operations, and finally it became very bad, and he was in tremendous amount of pain in the nursing home, and he gets his vision, like a vision in a physical meeting with the mother, and because he was crying out that I can't take this pain, just take me away, it's too much. So, after the incident with the mother, he described that as to what happened. And she said that if the pain is too much for you, she said, I'm doing on you a certain experiment as far as cancer goes. And that's why you're getting so much pain. But if you can't bear it, then I'll stop my experiment. He said, no, mother, carry on. And he took it. And you see, he related this when he had this meeting with the mother, I would say, But she's also said somewhere that she has conquered the cancer at the subtle physical. She is working to conquer it only in the physical. And what is this so much in cancer which is so obdurate, or it doesn't listen, or it's just pain sticking on?
So the thing is that many cancers are related to our style of living as well. Obviously, many cancers are related to viruses. Many cancers are related to things that we might take, like smoking is involved in every single cancer. Alcohol is involved in some cancers as well. So when all this happens, then I think we are ourselves to blame for it. If by any chance, you develop a cancer that is genetically related, so you're born in that family that has a propensity for it, then, you might say, okay, that's something that you have to deal with because that's what the divine has given you. But the reassuring thing is that, we are now given ways to deal with this. We're much further ahead. And now that you mentioned that it's already been conquered in the subtle physical, I can see it happening in the physical as well, where people will live longer despite cancer. And maybe at some point there will be some cancers that we may actually eradicate as well, if we, because we know the root causes of them as well. But that might not be the end of it. The divine might be prepared with some other condition that we've not even thought of that can affect the body. So, there will always be need for pathologists.
Yeah, especially an artist. Yeah?
In pathology, you are also looking for the process of what went wrong.
Yeah.
And you are able to track it almost to the level of the genes, if something has gone wrong. Has it been mapped that the certain emotions cause certain behavior of the cells, like particular emotions are making the cells behave erratically? And have they mapped about the effect of certain thoughts making the cells behave erratically? So when they say genome mapping has been done, does it mean that they're able to find this correlation?
So genome mapping definitely has been done, right? So for many cancers, so we have almost 1,000 genomes now for different cancers. What is definitely known is that one cause, as a big cause, is stress. Okay, so the way your mind is, your mindset, depression, all of those have been linked. So there are many studies that have shown that depressed people or people with a lot of stress, who live on stress, basically, have a higher chance of cancer, even if you exclude every other thing. So, for instance, a stressed person might be a smoker as well, right? But if you exclude that part of it, then there has been definitely a link. What hasn't been shown as yet, and I don't think the Western world will look into that easily, to say, okay, certain kind of thinking causes a certain kind of mutation. I think that link hasn't been formed yet, but the awareness is there. That and this is why we understand it a bit better. That any healing or any approach to diseases has to be holistic, right? That mind has to be involved in it, and the vital has to be involved in it as well. But in the stage we are at the moment, there's definitely a recognition that mental states do cause cancers, and they're given different postulates to it, but exactly what genetic mutation it causes, that hasn't been worked out as far as I know.
So even the current discoveries of the influence of this mind and emotions, does the current science hold that by tinkering with the genes, they will be able to cure if the causes and the emotions and thoughts? Have they reached a
So yeah, so in that situation, what you're probably doing is you are part curing it. You're almost treating the symptom. If the symptom is the cancer is a symptom of the mind problem, right? But then we are also saying that mind was the only thing that did it, right? It could be a lot of other factors as well. So in that situation, yes, you cure it up to a certain point, but yes, dealing with the mental situation is very important as well. And the amazing thing is, I've come across patients who have very aggressive cancer. They have had surgery, so like the one that has just been mentioned, 3 or 4 times, and they come back to work. I had a secretary who had a very, very aggressive cancer, and she used to go away for 2 to 3 months at a time because she had major surgery to remove cancer. She'd be back at work, and she said, "No, I have to be very positive about this. I want to live as long as I possibly can because I want to do my job," kind of thing. And it was amazing that somebody who normally would have passed away in 2 or 3 years actually lasted 10 years. Positive mind, yeah. So, without her knowing it, I'm sure she was affecting herself, and fighting the cancer as much as the surgeons were fighting for her as well. So I think there's a lot to do, with that. But hopefully somewhere somebody will actually look at the genetic mutations related to that. But it will be difficult to study because you have to remove a lot of other factors in it as well. And many of these genetic mutations are multifactorial at the same time.
It was a wonderful talk, and which for many see the God has given in life to us, but we are not aware of what is happening inside us. We are much more outwardly, conscious. Even when the scripture says in Indian that Brahmani, I am also somebody has translated that I am universe in the universe. So listening to your lectures on 2-3 points came to my mind and was we have many states. Is there any central cell which regulates the innate cell system? This is one. And second thing, when the body dies, the cells also dies. For example, with this during the COVID time, when the medicine was invented, the medicines were invented without dead bodies. It was also protected by the objected by the WHO scheme. So these medicines can affect to the dead cells also.
No, so the first question about so every organ does have regulatory cells. So they are the policemen that I was talking about, right? But the beauty of it is that every cell is liberated. It has its own freedom, so it knows its function, it knows when to die, it knows that it has to make way for a new cell to come through. Okay, and when a cell starts to misbehave, that's when the regulatory cell, the policeman, will come and say, okay, look, you need to get out, and that sort of thing. It's almost like there's a debate going on in that. So there are some regulatory cells that are in the body, but it's not like one central cell. The other thing that I should have said also is that not every organ has cells that regenerate. There's some organs that don't need regeneration. So, for instance, the brain cells, we only use a very small proportion of our brain cells, and new ones don't grow. What's happening is that we haven't awakened all the brain cells in our mind, So, again, the thought of reading Sri Aurobindo's writings will awaken the cells is exactly that you're starting to use other domains in it. But the divine has decided that the brain cells don't need to regenerate because you've got plenty there. But there are other organs where the cells do need to regenerate because they're doing such a function that they are actually providing protection to the body, right? So they're soldiers, right? So they need to be replenished. The second question was, what was the second question?
The second question was
Dead cells.
Sales also dies.
The cells would die, maybe not immediately, because if you think about a cell being like an individual factory, it's still got its elements in it. So if there's still a bit of oxygen in it, if there's still chemicals in it, then it'll still keep, functioning a little bit as well. So even after you've taken your last breath that we can see, there may be a little bit of activity in the heart still as well. So I don't know if anyone's ever been in a situation where if somebody passes away, the doctor doesn't come and certify straight away. They will give it a bit of time as well.
6 months.
Yeah, sometimes as many as that. But, they will take a little bit of time because the heartbeat might still be there, kind of thing. But the cells will eventually die. Yes, they start to decompose almost immediately as well. You see a change in the color of the skin as well. Yeah. So I'm not sure what you meant by the studies in COVID, unless what you're saying is that at the time of death, if you were to cultivate some cells, take some cells away, and then grow them in the laboratory, then you can keep them alive that way.
Actually, what I was trying to convey with this COVID times, medicines, some of the scientists, they try to test that medicines to their bodies. So my question was whether the dead cells can be.
So I don't think you can actually investigate on a dead body at all like that, Yeah. Yes. Yeah. Unless you take some cells just prior to death and then you grow them in the laboratory, that's a different matter. Yeah. Many of the people who study cancer actually have laboratories that have cancer growing in test tubes, because they're understanding that, that's how the genome is also discovered.
So,
So, most of the diseases are hereditary. So there's something about genetics. We inherit those diseases.
Some, not
Yeah,
most,
some,
yeah,
yeah.
some.
So how do we stop that programming from getting activated or taking over?
Yeah. So this is where there is manipulation of genes coming in. So there are some conditions where if, say, some parents have a certain condition and the mother becomes pregnant, you can do tests on them to see if they're carrying that gene or not, the defective gene. Okay, so at the moment we haven't got to the point where we can engineer the gene. We can, but most of the countries don't have laws that allow it. Otherwise, you'll be manufacturing humans according to your prescription, and you would try and bring Superman, like that. And I don't think the divine wants us to do that, at least at this stage, because it can go out of control. So, but if a defective gene is detected, then the mother is given a chance to consider abortion like that. And some people do take it seriously. And why bring up somebody? Sometimes some people will say, why bring up somebody, knowing that you're going to have a short life or a, terrible life or something like that. So there is work like that goes on. And so you can detect the carriage of these genes while the fetus is still in the mother.
So what I'm asking, is much more simpler. Say like, if my father and mother, both of them had hypertension, then there's every possibility that I would be having hypertension.
No.
So, no?
There's not every possibility. There is some possibility.
How do I prevent that?
Yes. What if you have that knowledge that both your parents had high blood pressure, so you take care of yourself. You can make sure that you don't. Your lifestyle has to change. And nowadays, there are tests that are done, for cardiology to say what is your chance of getting a heart attack or whatever it is. And if you know that, then you can change your lifestyle. Isn't that part of integral yoga as well? That you convert it,
or shift to Puducherry,
absolutely.
which you have half done in any case.
I didn't know that answer.
So he is moving towards it, I think.
And getting cold is good for health once in 6 months. The new cells will be created like that, I heard.
Getting cold.
Yeah. Then the old cells will get and the new cells will be created. I heard like this. But some persons know getting cold itself is a disease. This disease will affect earlier organs.
So the beauty about cold is another miracle of the divine. So you take COVID, right? During COVID, we knew what the agent was, the virus, right? And then during the 3 or 4 years, different little variations came out. I don't know if you heard of the Omicron variant and all that. Okay, so you said, okay, the virus is trying to be clever here. But the most clever virus is the cold virus, because it changes every year, right? And sometimes 2 or 3 times a year. And it's even different in different regions of the world as well. Okay, so what it is that, in fact, we need that, because if we were to get a cold this season, we develop certain defense cells. Okay, next season we get another variation of that virus. The old defense cells will still come out. Like I said, they'll be able to hold that virus until the new ones are produced. So it might take a couple of days.
For certain person, it will be for only 3 days. And the cold will get cured.
Yeah.
But some person, it will affect other parts of the body. That is what is said.
Yeah, it does. It does if you haven't taken care of other things. So you may have low immunity anyway. Say a person get a cold, has a low immunity. Then by the time the defense cells come through, they may have the agents might have gone through other organs in the body. A lot of people then develop a pneumonia after a cold or something like that. Again, there are many other factors with it: poor nutrition, old age, stress. If it means that you lowered your own immunity about it. So again, if you get a common cold, be brave about it. Say, hey, I've got it. I know what's happening in my body. It's treating it, handling it. I'll deal with the symptoms like pain or whatever it is. I'm going to visualize my defense cells in it, and it'll go. And also you can visualize to say it must not affect any other organ in my body. You put a shield.
And if you worry too much, it will stay on.
Yeah.
Right. So I think it's been a wonderful talk, really.
I've enjoyed it myself. He put me in a spot, or the mother put me in a spot through him.
I wish I could put you in more spots. So it's really joyful listening to you, and as she said, the artistry, the way you described the whole thing, very interesting.
I didn't see it that way necessarily, because maybe it come across like that. but that's how I feel every day. That's how I feel.
I was like, all the time thinking of Leonardo da Vinci, the anatomy, the science and the artistry together.
Yeah.
I mean, if I was taught biology like that, I might have chosen biology as a subject after 10th class. So, that's what I was thinking as a listener.
It's very true. A lot depends on who teaches you. And my affinity or my was affection for the body was actually fueled by a professor of anatomy in my very first year in medicine, and he was an artist as well as a professor of anatomy. And he used to, and in those days we didn't have computers or anything like that. So he had, in his lecture theatre, he had 5 blackboards, right? And he used to come with 20 different colors of chalk and used to draw the organs and the connections between the organs. And you could tell, he's like a painter, enjoying it. And he didn't mind rubbing it off because he knew the next day he could draw it again, and that's how, I learned it. And that's when I thought, who's made this, he's helping us to see the manifestation, but, it definitely makes us think that, the creator is just wonderful. We are lucky we can see things around us as creation, but inside there's as much as there is outside.
Thank you.
I personally know 2 postmortem doctors, and I have discussed with them some questions about dead body or something like that. But I'm sure nobody has seen the open body like you. Like you have seen the perspective which you have.
I just enjoy it.
They have just seen, they just do it like a job. It has come to me, and then just do it the way I put it. But your perspective is completely different perspective.
Yeah.
See the open body.
Yeah, and that's how I teach my junior doctors as well, to say, look at what's going wrong here, and look at this bit going wrong has affected this bit, and look at the connection. Then I'm also on the lookout for the divine amusement, where a little organ might be in a different place when we're looking for it and it's not there. And, oh, look, it's there, kind of thing. And it's just so much fun.
Like your first reaction was, oh my God, who structured to this body?
Yeah, absolutely. But the amazement doesn't go, because the best part of it is to say, all of us, we know our blood is red, right? We know that we breathe
Some
oxygen.
have blue, no? Some have blue. I thought some
Those
have
who can't breathe very well. So we know that the blood is red, but do we all know that our organs are in the same place in the body? Everywhere? Exactly the same place, held together by the same structures as well. If there were no support, like scaffolding in the body, all the organs would be in a heap, in a pile. But again, the divine has said, we're going to be under gravity, so we need to keep these things, propped up, kind of thing. And he's created, he's created designs, curvature of membranes that hold the things. And you say, okay, there's a curve in the body here, so let's curve the thing, and the flexibility and all that kind of thing.
sheer architecture.
Masterpiece. Yeah. If we only had inner vision, then we would be able to see that. But open up some biology books, please, and enjoy.
Sure. Okay. I think the tea is getting cold.
We can talk now.
Yeah, you talk over a cup of tea.
Of immortality on physical level, of fiction or planetary level.
No.
Oh.
It's a very different subject. Very different subject.
Well, the promise is there in Savitri, isn't there? So, yeah.
It's done. It's done. It says, Mother said that death does not exist. So that's 100% pakka immortality. So, thank you so much, Sanjiv.
Thank you for having me.
Quite a beautiful experience. And come again and enlighten us a bit more. And by the time you come again, you will have evolved also. You could tell us more, right?
We have done a project shows. Or maybe you could draw like you.
Yeah, yeah.
I'm not an artist, unfortunately. I didn't know I was a poet either.
So, Shelley,
Maybe I could do a projection of that sort of thing. Yeah, I mean normally I have given thousands of lectures on my subject, and normally it's to a PowerPoint presentation, where all the images are behind me and I'm talking and people can see the images. So in some ways it was a bit tricky, but this is also an experience to mention it like this. But you're a very receptive audience.